Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are talking to Katie Boston-Leary, who is the Director of Nursing Programs at the American Nurses Association, about the recent nursing strikes and union activity going on across the country. So, hi, Katie, how are you?
Good, G. How are you?
I'm doing well. Thank you for asking and for being here
Thanks for
today.
having me. Yeah.
Yeah, of course. So let's jump right in. What do you think are the underlying causes of all the recent nursing union and strike activity happening in the U.S. right now?
Yeah, well, it's a great question. There's a generalized dissatisfaction of the current state of the state from nurses. There are a number of things that nurses have historically, traditionally struggled with. And I think that the phenomenon that's happening right now is nurses are really saying no more, right?
Hmm.
There was dissatisfaction, but it was a dull roar. And now a lot of what's bubbling is manifesting in a lot of this organized activity. That is the big concern for a lot of administrators and hospital executives, but in some respects, nurses are using this as a last resort. Tried everything, and this is where we are. Kind of approach to this, and then there's some that are saying, maybe this is the way for us to have a voice. So, unionize, getting unionized is probably the way to go. So, there is a lot under the surface that's causing this, starting with staffing and the crisis that we're in. And then you have the well-being piece where nurses' well-being, their overall health well-being is compromised because of everything that's happening.
Hmm.
And we have data that actually links those two, staffing and well-being, together for nurses. And then there's everything else under after that. That's a close second, third, and fourth and fifth. There's workplace violence. There's unmanageable workloads. There's a hierarchical structure of healthcare systems.
Hmm.
There's the feeling of not being heard, the feeling of exhaustion, and not being able to do what you feel your patients deserve, and leaving every day feeling that moral distress. All those things has brought us to this point, unfortunately.
Absolutely. Do you think COVID exacerbated the issue?
I think so. I think COVID is an accelerator, an illuminator,
Hmm.
it just adds fuel to everything that we knew, and light to everything that we knew. So I do believe that that was where nurses did a lot of reckoning. And we all, as humans, during that time, it was a reckoning point for a lot of us where we examined our own personal lives and looked at, okay, what's really more important here? Given the close call that we all faced during that time, that self examination and introspection happened on the personal level with a lot of us as individuals, and it certainly happened within the nursing profession. Nurses took a look at things and they said, does it have to be this way?
Hmm.
And given a lot of what they're feeling and facing, they're voting with their feet, and their actions to make sure that things are changed for the better, not just for them, but also for a lot of aspiring nurses that will follow them as well.
Absolutely. Yeah. I think we as you're saying, it was a reckoning across, all industries and also our personal lives for sure. So what are kind of some of the pros and cons of nursing unions from a CNO perspective?
Yeah, it's hard for me to say that. I'd rather answer that from the perspective of, let's start with this. Um, Nurses have a right to voice their concerns.
Hmm.
And nurses find a number of different ways to do that through shared governance, through leadership, and in some cases through unions.
Hmm.
I've worked as a nurse and led in both. And nurses are not any less dedicated um, in the union environment compared to a non union environment.
Hmm.
It doesn't impact the care that they provide. It doesn't impact their engagement. Um, and in some cases, not all, but in some cases, people say, in some institutions get the unions they deserve, right? Because if nurses feel as if their issues are not being addressed, sometimes this is where they go for that to be a forced structure, unfortunately for some,
Mhm.
but not necessarily unfortunately for others.
What is the CNO's role in addressing the pain points that we're discussing?
It's not well for CNO, which is a role that I've been able to hold in the past prior to joining ANA. I've learned the hard way
Mhm.
that it's not enough to have an open door. You have to walk the walk and walk the talk, and really show people that you're listening. And nurses know that you're listening when you answer their and address their concerns, not just that you hear their concerns and you list them, and they end up on a project plan for some execution at some point. Nurses are looking for these things to get addressed. So, as
Mhm.
a chief nursing officer, it's important for you to go to the Gemba and understand what nurses are facing, what they need to be better for their patients. We have unintentionally set up a system that pull nurses away from what matters the most to them, which is spending time with their patients. We've created systems where nurses leave every day feeling that they didn't give the care their patients deserve.
Mhm.
And they also leave in some cases out of fear that that could cause that could have some licensure implications. So as a leader, and I know as leaders, nurse leaders, our lists are long and our days are long,
Mhm.
and you can't fix everything right away. But heavy is the crown, right? That we wear.
Mhm.
And while we're doing those things, we have to make sure that we take care of ourselves as well. So, as a chief nursing officer, you have to be close to the action and understand what nurses are facing, and go to them to understand what that is. Set up a shadow board in your departments for nurses to be able to give you feedback on in a structured way versus the fly by night kind of insights that you get. One of the best uh, speeches that I heard during the last election cycle that resonates with me, from a senator that won a seat. He said that to lead the people, you have to love the people. To love the
Mhm.
people, you have to know the people. And to know them, you have to walk amongst them. That's what we have
Absolutely.
to do as leaders. Our job as leaders is to care for the people that care for patients, because we don't take care of patients.
Absolutely. So, what is the ideal kind of goal or resolution between hospitals and nursing unions that would address those needs?
Well, having led in a unionized environment, I learned that I cannot treat unions as if they were the bad guys, because that was
Mhm.
a non-starter. I had to work with them. If they're here, they're here, and you have to work
Mhm.
with them and partner with them. And given how vast the issues are in nursing and how complex they are, you need all the help you can get.
Mhm.
So I enlisted them as support for a lot of the things that I needed, kept them informed of what was going on, and I asked for the same. It's very important, though, to understand that there are lines that, in terms of expectations, that I don't necessarily am going to do a mother may I whenever I want to do something. But setting up structures where we're in constant communication and engaging, and have it's kind of like, you have two parents and not let the kids see you fight. Like
Mhm.
with the union, you have to make sure that as a leader, the nurses see that you're working together for them versus
Mhm.
setting up an adversarial relationship where you're at an impasse most of the time. So that's the approach that I took. With them. And the other thing is, I think sometimes when it's a unionized environment, nurse leaders feel that every conversation that you will have with a nurse, you have to go through the union to have that conversation. I say
Mm.
no. If you have relationships with these nurses, still treat them. They are yours. They are part of your team, regardless of that union presence. And you can engage them and have conversations with them, and not necessarily have that feeling that you have to go through that entity for you to have a relationship. You should have a relationship with the people that or under your leadership, because uh, those relationships are important, and the unions don't necessarily have to come in between that relationship.
Absolutely. So would you say that kind of the ultimate goal here is just open lines of communication for both the nurses and CNOs to be able to address those issues?
Yeah, but it's the communication, but it's also the doing. It's
Mhm.
really, I hear you, and this is how I'm going to demonstrate that I heard you, because this is what I'm going to do.
Mhm.
And if I can't accomplish these things that I set out to do, I'm going to continue to keep you updated. That's the fidelity that we have to have with the people that we lead. So if you talk to a lot of nurses, especially with shared governance structures, they'll say, "Oh yeah, we've communicated ad nauseum
Mhm.
that X is a problem, and yet X is still a problem." So we have to get to a point of resolving a lot of these issues and managing these pain points, because it's at the point of being unbearable for nurses, which is why we're seeing all the activity that we're seeing.
Absolutely. So do you have any advice for CNOs for communicating with the C-suite level of or the C-suite aspect of this conversation?
Yeah, I think it's really a matter of, and that's the thing, right? Because as a CNO, leadership does not have to be lonely. You have to
Mhm.
engage the CEO, the COO, your CFO, all these O's and C's
Mhm.
and E's, to make sure that we're all in lockstep to address what nurses face. And I'll also take it a step higher. I do think that any institution that has nurses as the largest workforce should have a committee on the board that also focuses and pays attention to and understands nursing's issues. So it's the C-suite, but then a little bit beyond as well, because we've seen this movie and how
Mhm.
it plays out. When you have dissatisfied nurses, it could upend an organization a number of different ways, starting with patient outcomes. So yes, the C-suite is important for that support, and unfortunately, some of those relationships have not been good. I've had that experience too in some cases where, especially with nursing being seen as a dispensable commodity,
Mhm.
it's always a matter of managing your budget. And it's amazing how sometimes if your budget's not bright, how it impacts the relationships around you in the C-suite, where you're the smallest voice in some cases. So
Mhm.
you want to manage that to make sure that, there's an understanding of the fact that this is not this is a very complex group of professionals in terms of working through a lot of the challenges, and we have to make sure that there's an understanding of the value of nursing, where
Mhm.
just because it's not showing up as a line item budgetarily, it does not necessarily mean that they're not adding to our net profit or our net margins. There has to be an understanding of that. So that is the way to turn the corner with the relationship with the C-suite, and they need to see what you see as much as you can have them see it, and move away from the belief that I need to get my leaders to speak your language. You need to all, and you as someone that's not in nursing also needs to understand the other side. That's how we move forward.
Absolutely. So why do you think there is that disconnect? Because to me, as somebody outside looking in, like you're saying, I think, from my perspective, nurses are the backbone of the healthcare industry. So why do you think there is such a disconnect about the value of nursing?
Well, it's set up traditionally
Mhm.
that it's swallowed in room and board and supplies and all those other charges. So it's not showing up the way it should, and that is a disconnect. And I think once we get to a point where we can show how nurses are adding value
Mhm.
every day to organizations around the country, I think that would be where we get to a different place. And it's important because um, a lot of good leaders have been moved on
Mhm.
because of their inability to manage nursing
Mhm.
costs and expenses. And there are people that are hired because of their ability to manage and reduce nursing expenses. That is not the way to go, right?
Mhm.
We have to really think about the fact that this is a value added body that is a necessity for any organization, and it should really be from a standpoint of support
Mhm.
versus managing in terms of managing costs. I think that is a disconnect that we have to fix. And it's a tall order because we've been in this place for a very long time. And are there any motivating factors for us to look at this differently right now? If you're not a nurse or a nurse leader, probably not.
Mhm.
I don't know that there are a lot of CFOs that are really looking into this with a lot of vigor that we find with other initiatives, but it's time. It's high time that happens because that's where we start changing the thinking and move nursing leaders, really good leaders, out of the place of having to defend all the time, especially in this place where acuity is high.
Mhm.
Med surg units are like, you know, step down ICUs because patients are so sick and their disease processes are so complex. And you have this issue where nurses are not as prepared as they used to be coming out of nursing schools. So
Mhm.
we have to make sure that we get all hands on deck and everyone involved with closing the loop to make sure that we're delivering optimal care to patients that deserve it in our communities.
Absolutely. I could not agree more. Well, thank you so much for your time, Katie. And I'm really grateful to have met you and gotten to know you. And I think, this is a very pertinent issue that's going to continue, especially in going into 2024. So thank you for your insights.
Sure. Thank you for having me.